from control to connection, shifting the therapeutic focus from behavior management to relational development, by Adam Terpstra. In clinical practice, particularly when working with children, youth, or individuals navigating complex mental health or developmental challenges, behavior management is often the starting point. Understandably so. It offers structure, predictability, and a framework for immediate safety and stabilization. However, as clients move towards healing, growth, and relational capacity, behavior-focused models may begin to limit rather than support patient development. This post explores the essential shift from behavior management to relational development, what it means, why it matters, and how therapists can facilitate the transition. It also draws on insights from Hughes, Golding, and Hudson's 2020 book, Healing Relational Trauma with Attachment-Focused Interventions, which provides a powerful framework for deepening therapeutic work through the relational stance of PACE. Understanding behavior management. Behavior management refers to structured strategies aimed at reinforcing desired behaviors and reducing problematic ones. These approaches can include behavioral contracts or plans, clear expectations and consequences, positive reinforcement, for example, token economies or praise, timeouts or withdrawal of privileges. These tools are especially useful in acute or high-risk contexts where safety, regulation, and predictability are paramount. Behavioral strategies can help clients develop basic self-regulation skills, follow routines, and reduce disruptive or harmful actions. However, behavior management has limitations. It is often external in focus and compliance-oriented, centering on what the client does rather than what they experienced or need. While effective in the short term, over-reliance on these methods can miss underlying emotional, relational, or trauma-related processes. Introducing relational development. Relational development shifts the focus from managing behaviors to understanding and nurturing the relational patterns that underlie them. This approach is rooted in attachment theory, developmental psychology, and trauma-informed practice. It emphasizes building internal motivation and secure identity, emotional attunement and co-regulation, empathy, curiosity, and connection over compliance, safe, consistent, and responsive relationships. Rather than asking, how do I get this person to stop that behavior? Relational work asks, what is this behavior communicating? And how can I meet this need in relationship? Hughes, Golding, and Hudson describe this shift as essential when supporting clients with relational trauma, where behaviors often reflect survival-based adaptations, not conscious choices. These clients need connection, not correction. Introducing the PACE model. One of the most practical and compassionate frameworks for this shift is the PACE model: playfulness, acceptance, curiosity, and empathy. Developed by Dr. Dan Hughes and foundational to dyadic developmental psychology. As outlined by Hughes, Golding, and Hudson, PACE helps create emotional safety and foster trust by embodying the kind of relational presence that disarms shame and defense. Each component supports relational development. Playfulness invites joy and reduces tension, helping clients feel more emotionally accessible. Acceptance reassures the client that their internal world is safe to share, even the messy parts. Curiosity communicates, I want to understand your experience, without judgment. Empathy provides resonance and connection. That really must be hard for you. PACE shifts the therapist's stance from managing to being with, laying the groundwork for healing through relationship. Making the shift. Clinical reflections and guidance. Transitioning from a behavior management model to a relational one is not about abandoning structure. It's about reorienting it. Here are the key clinical principles that guide process. Recognize the function of behavior. All behavior is communication. Before seeking to extinguish a behavior, consider, what need is this meeting? What experience is this expressing? Behavioral strategies often assume that the client is capable of self-regulation and perspective taking. But Hughes et al. Remind us that many clients operate from a place of survival. They are not resisting care, they are protecting themselves. Shift from stop the behavior to understand the person behind it. Prioritize emotional safety. Clients will not explore or recognize they're in a world unless they feel safe. That safety comes not from rigid control, but from consistent, attuned relationships where rupture and repair are possible. This stance of pace provides exactly this kind of safety. It offers emotional presence that helps rewire defensive relational patterns shaped by early trauma. Support co-regulation before expecting self-regulation. Especially for clients with early developmental trauma or attachment disruption, independent self-regulation is not a given. It is earned through co-regulation. A relational approach offers the emotional scaffolding that makes regulation possible. Use curiosity over correction. Behavioral models often rely on correcting what's wrong. A relational stance invites us to ask, what is this moment inviting us to notice? Curiosity creates room for complexity, especially when clients do not yet have words for their internal experience. Reframe resistance as protection. Clients who resist engagement, boundaries, or emotional contact are not being difficult. They are protecting something vulnerable. Hughes et al. Frame these actions as survival-based adaptations. The work is not to confront resistance, but to soften it through consistent, attuned relational presence. Create relational moments, not just interventions. The intervention is not always in the plan. It is often in the micro moments of shared laughter, a steady presence during distress, or a quiet moment of being seen. These build the relational safety that behavioral compliance never could. Use pace to build connection before expecting change. As therapists, we are not simply guiding behavior. We are shaping a new relational template. The stance of pace reminds us that connection is the mechanism of change. Through playful, curious, and empathetic engagement, we help clients internalize safety, worth, and trust. Final thoughts. Integrating structure with connection. This shift is not about choosing one model over another. It is about sequencing and integration. In early phases of care, some clients need structured behavior supports to feel safe. But once stability is achieved, the work of healing asks us to go deeper into trust, vulnerability, and the relational field. As therapists, our job is to recognize when it is time to stop asking for control and start offering connection. Because in the end, it is not compliance that transforms, it is relationship.